This is Whitley Strieber, and you have made a courageous choice. You're listening to Dreamland, a truly free, non-commercial voice on the Internet. And from 22,500 miles in the sky on 1.FM and the Global Star Communications Radio Network. We say it like it is. We take you where others will not take you. Dreamland, welcome to the edge of the world. Rick Strassman is with us, and he is, of course, the author of a revolutionary book, DMT, the Spirit Molecule, and was a sensational Dreamland guest. And incredibly enough, I've just realized that it has not been since 2001 that this major member of our community of searchers and people working at the edge of science and reality has been on this radio program. So, Rick, first of all, I would like to welcome you, and second, I would like to remind you, folks, that Rick Strassman's book was one of those groundbreaking books. DMT, the Spirit Molecule, was a book about a series of experiments he did at his university, the University of New Mexico, involving the use of a hallucinogen, DMT. And Rick, we're going to go far beyond that at this time. We're going to talk about the documentary that he's making now and his work that he's doing now. But why don't you first tell us a little bit about what went into DMT and why was it written?
In terms of my interest in DMT, it kind of sprung from an interest that I had that basically began in my 20s. In college and from my own studies, trying to determine if there was some sort of biological, basis to mystical experiences. And I was struck with how there was a great amount of similarity between people's descriptions of their experiences on psychedelic drugs and the experiences that people reported as a result of either deep meditation or mystical states, or even some of the reports that were coming out at the time regarding near-death experiences. So I started to speculate that there must be some chemical in the brain that was, responsible for producing these effects in non-drug states, but that was probably similar to a hallucinogen in structure and in its function. I began to think about the pineal gland as a possible place in which these chemicals might possibly, be made. I kind of kept a lot of my theories to myself over the years. I went to medical school and trained in psychiatry, but at a certain point in the early 1980s, there began to be an interest in the pineal gland again in human beings, especially with respect to its putative, role in winter depression through the production of the pineal hormone melatonin. And so that appeared to me to, be a golden opportunity to begin, to look into the function of the pineal gland in humans. In the late 1980s, I ran a study on melatonin in humans, but it didn't seem to be especially psychoactive. So I wrapped up that study and started looking for some other putative, pineal compound that had some more psychoactive properties. I then sort of stumbled upon this drug, DMT, and even though there isn't any, established objective data that the pineal gland, makes DMT, there's a lot of strong circumstantial evidence. And there is plenty of evidence that DMT is made in the brain and in the blood and in the lung and in a number of other, tissues in the human. So I started looking into doing a DMT study. It took a couple of years of paperwork and interacting with a bunch of regulatory agencies over the years, but I began that study in the late, in the beginning of the 90s. Ran the study for about 5 years. Wrapped it up in 1995.
And then you wrote DMT, the Spirit Molecule, and you had during the study which was EPA approved. I believe the first one in many years of a hallucinogen that had been approved by the EPA out of fear that arose from the LSD revolution. And what did you conclude from the descriptions of experience that your research subjects brought back to you?
Yeah. It's a very, it's a huge issue. And,
yes.
The stories that the volunteers returned with are just, were just unbelievable. And it actually, took me a number of years, to get a grip on the enormity of the reports and the implications that, could be, kind of implied from, some of the descriptions of people's experiences on a high dose of DMT, especially with respect, to the natural occurrence of DMT in the human body in, all people at all times, pretty much. It might be helpful if I gave a little bit of background in terms of actually what the DMT study involved.
Yes.
I recruited around 60 volunteers, and all of them were experienced hallucinogen users. The first, series of studies was primarily intended to establish, to generate as complete a database of the DMT experience as possible in terms of its biological effects and its psychological effects. So we gave a number of different, doses of DMT. We gave it intravenously because it's smoked on the street as kind of a minor recreational drug, but it isn't active orally in most cases anyway. And when people use it recreationally, they smoke it. And, the most comparable means of giving it to people other than smoking it in a clinical research, setting is to give it intravenously. And it's a very fast-acting drug. It starts working within a few heartbeats. And the peak effects occur within a couple of minutes, actually, and people start coming down within, 3, 4, or 5 minutes. And they're transported into a completely autonomous, freestanding, independently existing kind of universe.
So what does it look like? It's extremely colorful. It starts off extremely colorful. The visual, field, breaks up into pixelated kinds of shards early on in the experience, the first, half a minute or so. And, it's important to close one's eyes because it can be rather distracting. And so the colors get faster, more intense, and then people seem to kind of, so with the colors there comes a kind of corresponding kind of sound, a high-pitched crinkling kind of sound, and a very powerful, experience of an internal kind of pressure that starts off building in the chest, then kind of goes throughout the whole body. And it seems as if the body is no longer able to contain this feeling of pressure, and people burst through or out of the constraints of their physical bodies. And their experience for the next few minutes seems to take place in kind of a disembodied state, as it were. In another reality or in this reality?
Well, I was struggling with, the location of people's experiences. Was it purely at their minds?
Yes.
Was it purely in their brains? Was it this reality, or, was it some other reality? So, was it some kind of a psychological projection? Was it an imaginary realm of some sort? And, as time went on, I gave a lot of doses of DMT, close to 400 doses over the space of these studies. And, a large part of the inner work that I was doing at the time was trying to create an internal context, to understand these experiences.